Hi, and welcome to our first Alumni Spotlight conversation. I'm Jeff D'Amelia. I'm a double jumbo in CS, and today I'm going to be talking to Patrick Schmid. Patrick, thanks for talking to me today.
Hi, Jeff. Thanks for having me.
My pleasure. So let's dive right in. As a start, can you talk a little bit about your career at Tufts?
Sure. So I graduated Tufts 2005 as a double major in CS and International Relations. I actually started off as an IR major and took a CS class to get out of a math requirement. That backfired a little bit because I ended up taking more math than I initially wanted to, but it ended up going well because I liked computer science.
Fantastic. So what did you do when you left Tufts? Did you get a job? Did you work in a particular industry or anything?
So my senior year at Tufts, I did some research with Lenore Cowan in computational biology, and that interest kind of continued. Ended up going to grad school for computational biology down the street at MIT, and then continued that with a postdoc after that. So didn't get a job right away. Did the research thing for a bit. Then during grad school, just realized the publisher parish wasn't for me. Academy is great, great respect for it. Just wasn't for me, and decided to go to industry. And so after my postdoc, I hopped over to industry and joined a startup.
Fantastic. Can you talk a little bit about what the startup did?
Yeah, so it's a company called Activate Care. We're based in Boston. I'm still there actually, and we are a company that deals with social determinants of health. So those are things like housing, food, transportation needs that lots of people that have a big impact both on people's lives, obviously, but also on outcomes in healthcare. So, for example, someone that doesn't have a home to go to, or doesn't have food, or doesn't have a way to get to an appointment, is much less likely to do well than the same type of person that has all those things taken care of. And so we're providing a platform for the case managers, nurse coordinators, and all those wonderful folks that are helping these patients and these people get those needs and coordinate those needs.
Oh, that's great. So, given everything that's going on with the kind of global pandemic and COVID-19, what is your company kind of doing in that space?
Great question. So again, our platform is really for those social determinants, things like housing and making referrals for that happen. So directly, we're not doing anything to solve that. But one of the big things that's kind of come next after the initial spike of the medical pandemic is going to be this social pandemic or the second wave, whatever you want to call it, where all the people that are now at home or out of jobs or have all these things that are affected them because of having to stay at home and all the social distancing, that's going to have a big impact on that social side afterwards. And we're preparing and making sure that the case managers and nurse coordinators, all those people that are using our platform, have the tools they need so they can help those wonderful folks as much as possible, so everyone can get back on their feet as quickly as possible and return hopefully to normal soon.
That's great. That's and very, very interesting work, and thanks for sharing that. I guess just one last question as we kind of wrap up here. So, given all of your experience between, graduate school and working in a startup, particularly one in the healthcare sector, which is really growing these days, what kind of advice can you offer some of our young alumni who may be just starting out in their careers?
Um, you know, I jokingly always say I don't know the right way to do anything, but I know a lot of things that I have done wrong. And I think that's one of those things that the advice I give is try a lot of things. You're not going to get it right the first time. For example, I went to grad school to academia, and ended up deciding that wasn't for me. Um, I currently like my job is fantastic. I'm having a great time at it. But if you find a job and you want to go to a different job, do it. Change your career. It's about making sure that what you do on a daily basis doesn't feel like a job, but feels like something that you really are passionate about and want to do and continue to do. So try to find that, and don't be afraid to try different things and yeah, switch around.
Great, great advice. Well, that's all the time we have for today. Patrick, thanks for taking the time to talk to me.
Jeff, thanks a lot.
Take care.
Bye.